If we wanted to test the effect of stress on fertility, we need to answer three questions. First, does stress affect fertility? Second, do interventions reduce stress? And third, does that reduced stress improve fertility? So if we really wanted to show a causal link, we would have to look at these three questions. So we'll take these questions one at a time. First, does stress affect fertility? There have been multiple studies that show decreased fertility with increased stress. There are also multiple studies that show no change in fertility with increased stress. And there's even one study that I didn't believe, so I had to look it up, that showed improved fertility with increased stress. So we're all over the board on this one. And why the mixed results? It's possible that we have different definitions of stress. As I mentioned earlier, it's not easy to define. Could be that they have different tools for measuring stress, or that they had different fertility endpoints. For example, a positive pregnancy test versus a live-born. Could be it's just statistical aberration, or that it's a subtle finding and we need a lot more patients to look at before we can draw a conclusion. Our second question, does intervention reduce stress? This one's not controversial. There is clear evidence that counseling can decrease stress and decrease the stress response in an infertility population. And our third question, does the reduced stress improve fertility? And here it appears no. At least one study shows that counseling doesn't seem to improve fertility rates. But looking at the reverse question, not does stress cause infertility, but does infertility cause stress, here the evidence is pretty clear. Infertility is stressful, and infertility treatments are stressful.